Most people don't know who to trust with their wellbeing information. Most people don't really know what to do. They instinctively know they might need to lose weight, they might need to move more, they probably need to sleep better. But how do they do that, and how do they change those behaviours is becoming quite a challenge. Good morning everyone. My name is Gethin Nadin. I'm a psychologist from the UK. I'm also a 2 times best-selling wellbeing author. Because there's so little of you in this audience today, if anyone would like a free book, connect with me on LinkedIn and I will send you one of my latest bestseller. But I want to talk to you today about well-being. I think well-being generally, as far as the workplace is concerned, has started to attract a lot of attention in the last few years. That's been buoyed by investor interest, shareholder interest and consumer interest. Following the pandemic, we saw a significant volume of research that started to show that consumers themselves want to buy from organizations that treat their employees well. We saw this in earnest in the US, where lots of organizations didn't pay sick pay, and during the pandemic consumers were saying, if you're making people come to work effectively because they're too poor to stay home, that becomes a public health crisis, so you have to pay them sick pay. And as a result, more than half of the US states now pay sick pay, and that's as a direct result of the pandemic. I mean, it only took a global pandemic for people to start listening that we should take care of each other in the workplace. But if we start to think about why the workplace is starting to focus more on employee well-being, we can start to link about three decades worth of research to things like shareholder return, profitability, resilience to volatility. So that means organizations that prioritize employee well-being weather the storm of things like economic crises better than others. Brand reputation, innovation, sales. If you have salespeople in your team, the higher their mental health, the higher they rate their mental health, the more they will sell. If you have healthy and well teams in your organization, you will develop better products, you will innovate more. And it kind of makes sense with other things as well, like customer loyalty. If you start to think about somebody who's really struggling, somebody who's not in a great place, is not going to deliver the kind of customer service you might expect them to. But as I mentioned at the start, something that's really interesting now is how we're starting to see investor behavior follow this trend as well. So last year, about 90% of the top 600 investors in the US said that before they invest in your company, they want you to demonstrate that you treat your employees well. Really significant shift. We're now seeing the money follow all of this, so we can again start to link great business to high employee well-being. But we've got a problem with all of this, and that is that employee well-being is at record highs. So lots of people are really struggling. In the UAE at the moment, about 65% of people said they've really struggled with their mental health in the last 12 months. You know, we are well clear of the pandemic and people are really, really struggling. The expectation is probably over the next 10 years, that might not get better unless we kind of make some pretty firm decisions. So what's really interesting here is that employers are now starting to think, what do I actually need to do? What does good look like when it comes to workplace well-being? And I kind of break it down to 3 different sections. The first one is the structural design of your organization. So how do you better serve the well-being of your people by the way you design your organization? So this is where well-being is hidden in policies. Getting recognized for a job well done, having clear expectations from your manager, working with teams that you enjoy working with. All these things can be designed to create a culture of well-being in the workplace. The second one is employee behavior. So those employees themselves have to take care of themselves. The evidence tells us lots of people need guidance with that. Most people don't know who to trust with their wellbeing information. Most people don't really know what to do. They instinctively know they might need to lose weight, they might need to move more, they probably need to sleep better. But how do they do that, and how do they change those behaviours is becoming quite a challenge. And it's the reason why we have conferences like this, telling people to slow down, to practice mindfulness, to find more moments of quiet reflection. But we need that in the workplace as well. And then the third thing is, how does the workplace support the employee through the challenges they'll go through in their lives? Because unfortunately, we will struggle with life. We will go through divorce. We'll fall into debt. Our parents will die. We'll have caring responsibilities for children and our parents. And they will all put huge strain on us. So how does the workplace respond to those things and put the right things in place to be able to help us through life's challenges? And so that typically tends to materialize globally in things like the benefits you offer. So you have health insurance. So if you break your leg, if you have a mental health crisis, the employer is paying for you to go and see somebody to get that support as quickly as possible. And I think those three things need to come in balance. The challenge is, I think, if you took somebody out here at the moment that works for a large employer in the UAE that has got a six-pack, that eats everything they should, that doesn't drink, that doesn't eat chocolate, that exercises every day, has the great sleep and great mental health, but they don't have a great time at work, they don't have a great boss, they have a negative experience, they have unclear expectations, nobody ever says thank you for the effort they put in, that person's well-being will not be as high as it should be. And likewise, somebody who has a great experience at work, but has a terrible diet, who isn't sleeping very well, that balance is going to be off. And so what we're starting to see now is employers know historically what they need to do to support the lives of their people, but now they're becoming far more paternal, which is, how do I help you to live a happier and healthier life? So that's why we've seen the rise of things like Calm and Headspace, these corporate apps that are being offered to employers. But what's really interesting, I think, is in the work that I do, trying to convince employers to do this because it's the right thing to do is a really, really difficult challenge, because we work with big commercial entities that want to see a positive return on investment. So what's interesting now is when we look at workplace well-being, we can directly link that to enhanced employee performance. So there's a great study conducted by Microsoft a couple of years ago where they took people who had back-to-back Zoom meetings all day, they got them to finish those meetings 15 minutes earlier and got them to practice mindfulness before going to the next meeting. And they scanned the brains of all these people and found that those people were not only less stressed by the end of the day, but they were still less stressed by the end of the week. And that was just 15 minutes out of somebody's day to practice some meditation. We also know that journaling in a workplace context has a significant impact on employee performance. So when you get employees to journal at the end of the day, to reflect on what went well that day, the good customer conversations they had, the projects that went well, the colleagues they got on well with, they will perform 20% better the following day. 20% extra productivity is a significant achievement. That's like getting another day out of employees every week. And again, some studies that show even in people's busiest days, when they are overwhelmed and when they are stressed, if we get them to stop working, to step away from work and go for a 15-minute walk, their productivity and performance will actually improve. And it goes against convention, right? In a really busy day, the worst thing that it could seem like to do when you're really stressed and busy is to actually stop working, because the expectation is that's going to make your day a lot worse. But the data is telling us that actually improves employee performance. And we're also now in a position where organisations are being pressured by governments. I do a lot of government advising in the UK. We have a new UK government at the moment who is really seeing the workplace as a way of helping us solve some of the sickness and absence problems we've got in the UK. We're actually the only country, the only OECD country that hasn't recovered from its productivity levels from the 2007 financial crash, which, by the way, was one of the most significant things to happen to people's well-being globally, followed by the pandemic. So we've had 20 years, those two events over the last 15 years or so have had a significant impact on people's well-being and a significant impact on their work. If you think about Dubai and the achievement to get to 2030, the future of Dubai, a lot of that relies on people. For this country, for this region to get where it needs to be in the next 5 to 10 years, we have to adopt a people-first attitude in the workplace. And thankfully, we now have a whole host of evidence to prove that when employers put employee well-being first, they actually create much better, high-performing organisations. Thank you. I think we've got time for questions, if there's a question. Or if somebody wants to argue with me and tell me I'm wrong. What's my book about? So my first book is called A World of Good, Lessons from Around the World in Improving the Employee Experience. And that is a chapter dedicated to a cultural practice in different regions and what we can learn and apply to the workplace. And the second book is called A Work in Progress, Unlocking Wellbeing to Create More Sustainable and Resilient Organisations. That's got lots of case studies from really global employers, and it really delves into what are the policies you need to create to drive well-being. I mean, a really good example is if you have a sexual harassment policy in your organisation, even if it's a rubbish policy, you will still have less instances of sexual harassment in your organisation. So it shows you how you can start to design the organisation to better support well-being. And it takes a fairly big stab at the multitude of mental health apps that now exist globally. At last count, you can get about 900,000 different wellbeing apps in the various app stores around the world. Less than 10% of them can prove they actually make a difference to people's well-being. So it's about how do you take that evidence-based approach. If you're an employer that wants to buy in these tools, buy new benefits, how do you actually search for that evidence and what are the kind of questions you should ask? Thank you. I think it's a really good question. I actually get asked this quite a lot. The question was, how do we help employees to understand that prioritising their well-being and mental health is important? I think with the companies I work with, so on the run-up to publishing my second book, I ran 200 different well-being workshops with employers around the world, gathered a significant amount of data, work with lots of organisations to try and improve employee well-being. The only thing that we really did that seemed to crack that was when we showed employees that them being a good employee, being a high performer, is related to well-being. So if you want to do meditation, you can do it in work time. And so what that meant is people don't get to the end of the day, get to the end of the week, they're really tired, they just want to watch Netflix, have a takeaway. We're telling them to use the work time because we actually know that's going to enhance their performance. So the net result is obviously you get healthier employees. But we've just published a case study with one of the big customers we work with globally, a big utilities provider, a couple of days ago. They got a 12% reduction in turnover through us just encouraging people to go out for walks and meditations. So that's saving them millions. And so you don't have to have that much of an effect on an organisation to start generating some savings. But thankfully, I think more and more customers and employers that we work with are starting to think that way. Thank you very much.